Joining me now to discuss, Republican Senator Bill Cassidy of Louisiana. We should mention he's also a doctor with experience in public health. It's great to have you on. We're doing our best to speak to folks who know the most, so we appreciate you taking the time this morning. First, let's speak, if we can, to the current situation. You have a couple hundred people who've tested positive so far, but we really haven't begun to test large portions of the population, and there's been some delays in getting those tests out. What should people expect as the U.S. tests more people? Should we expect that number to jump?
The number will absolutely increase, and it depends on where you live. If you're in Shreveport, Louisiana, your risk right now is extremely low. If you're in Seattle, it is higher. And there is some mathematical modeling suggesting that Washington State could have some problems. And so that means that you have to go in, find your person of interest, the person you know is infected, and just start testing the people around he or she, ideally asking them to avoid contact with others as you gain control of that infection. Early
on, the standards, the criteria for testing someone, you've heard this even from Anthony Fauci, for instance, NIH chief on infectious diseases, were too tight. In other words, we weren't testing enough people. We should have tested more. Was that a mistake in your view?
It was a mistake. One thing we learned from the Chinese pretty early on is that there are people who were infected but not symptomatic. And so they would then go and give it to others. So I'm infected, not symptomatic. I go and give it to you. You become symptomatic. I never know that I'm infected.
But still infected, those people.
Still infected. And so that's been very well established in China now. So we could have intuited that because there's other viruses, for example, hepatitis A, very low impact in children, major impact in those who are older. So we have kind of the paradigm of that could have been the case.
So now, if there is that realization, and we have heard that from the experts, do we have enough resources to do it, though? Because Vice President Pence, I mean, he granted yesterday, we don't have the kits at this point to test all the people we need to test.
So they're suggesting that it's going to be 1.25 million, the capacity to do 1.25 million cases by the end of this week, I mean, today. Now, you can't nationwide probably get 1.25 million people in to be tested. So I think that we will gradually expand both our capacity, but also our capacity to test. And ideally, public health is finding that person of interest, checking everyone around them proactively until you get to people who are truly negative, then you stop.
You have heard, and you're an expert at this, you've heard, like Americans have heard, conflicting messages coming out from the administration, because you will have the president say, and trust me, I understand the reason to tamp down panic. No one wants anybody to panic. On the other hand, you want the most accurate information out there. The president, for instance, said this morning, we closed it down, we stopped the spread. Then we talked to Sanjay Gupta, and he said, listen, no, because we haven't tested enough. How important is it for the administration to be speaking with one honest voice on this?
You have to view this as somewhat of a fugue, if you will. Two different messages spiraling around. If you're in a place, again, go to Monroe, Louisiana, where there is no one who's yet been diagnosed and you've not yet had connection with those who are infected, one message for them. You don't need to wear a mask. If you're in a suburb of Seattle where there's a 19-year-old who's been diagnosed with community spread, it is a different message. So if you will, the broader message is still, don't panic, wash your hands, get your flu shot, sneeze into your sleeve. But if you're in another area, you have to be, wait a second, if you're going to a nursing home, you may have different precautions than otherwise. So the breadth of our country means that we have to have more than one message. The American people have to kind of digest that.
Okay, fair enough. If you were recommending to people at home, I need to listen for what's right for me, what's the best place for them to go? Who should they be listening to?
So your local public health folks will be the ones who have the message that is specific for you. But let's just go to the recommendations that are general. Get your flu shot. Again, one more time, if you sneeze, sneeze into. I carry hand sanitizer with me and wash my hands constantly. I like to say that instead of shaking hands, you can bump elbows.
Okay, we'll do that so folks at home know
how
to
do that. Or bump fists. But just do those things which are common sense that would and if you're sick, stay at home. Don't muscle it out and go out.
So that's the thing when I speak about message, because you heard the president yesterday seem to imply that folks can still go to work, whereas you had the CDC saying, not a good idea.
It depends on where you. If you're sick, don't go to work.
Fine. That's a clear message you're saying.
Yeah, that's a message. Don't go to work. If you have the flu, the regular influenza, don't go to work. But otherwise, yes, go to work. You still got to feed your people.
Of course. That's what I meant. I meant to imply when you're infected. Final question, if I can. As these numbers ramp up, as you test more, are you confident the communities around the country have the resources to then treat them, to quarantine them, to make sure they follow the steps necessary to make sure it doesn't spread further?
It depends on how you define resources. If you define resources as there's going to be enough public health access, there's going to be enough hospital beds, then I'm fairly confident. What we also need to do, though, is have a better way of tracking that person of interest.
Yeah.
So what Taiwan and mainland China have both done is figured out who was infected, and then they were able to look at everyone they had come in contact with.
Using location services, you say, like their electronic device.
Using a location service. That's what law enforcement does now. You can anonymize that data with kind of public health safeguards and, if you will, civil rights, civil liberties safeguards. But if you're infected, Jim, I need to know everyone you've had contact with for the last week.
Yep.
And then you go and test them. And you get a negative, you stop. If you get a positive, you keep on going. We need to have a 2020 way of tracking contacts, not a 1950s way of tracking contacts.
Smart point. Always good to have the doctors on.
Thank you.
You're always welcome on the program. Appreciate you taking the time, and we'll do this. That's the smart move.